Hello, this is Dr. Do again. This video is on alphabetic list problems, still on letter M. Today I'm going to talk about, I think I have mentioned before, the macular diseases. It's several, it's not just one or two diseases, but in this category occur in the macula. And let me just bring up the emergency situation. Any emergency situation that associated with this macular disease that you need to visit emergency, either ophthalmologist or emergency department. Yes, if because this macula is on the back of the eyes, it's part of the retina. So of course, if it is the detachment of retina detachment, it is regardless in terms of medical standpoint, in terms of management. The acute or not acute is the judgment of the physician. However, for the patient, as a patient, regardless if you have this acute vision, decreased vision, and or not seeing well, or acute eye pain, or any, of course, injury, or any problem with your eyes, pain or not painful, with decreased vision occurred in short time, or feel like the curtain falling off. So any of those kind of situation may or may not be the macular, but still it is emergency situation. In terms of the retina detachment, whether it's emergency can be managed in acute or emergency situation, that's the judgment of the retinist or the physician or the ophthalmologist. But for the patient, if you have any symptoms I just mentioned before, see the emergency or talk to your ophthalmologist as soon as possible. And as for this macular diseases, can you manage at home? Probably not, even though the diagnosis, for example, the macular degenerative change or the macular edema, probably in some cases, no need to manage, no need to do anything but just watch. Still, this watch is not watched by the patient itself, but it needs to be guided under the guidance of the physician. So this is, probably is not is manageable at home, but you can use in terms of preventive standpoint, you can start this antioxidant like multiple vitamins to delay the degeneration process. It's well studied. You can do that, but in terms of the management, you cannot manage at home. So let me just talk about the macula. What is the macula? You probably know it. It's just a center of the vision, I should say. Actually, it's the eye structure I mentioned before. On the back of the eyes, it's the retina, just like the film of the camera to catch the photos. Through those photoreceptors are the different kind of cells, the cone cells or the rod cells, just the shape of the cells. Responsible for the dark vision, seeing clearly at dark, or sharp vision, seeing clearly image. So these are the fundamental structure. Of course, there's some other cells affiliated with this retina function. And the macula is really the center of this retina, responsible for the sharp vision, and it's it's next to the optic nerve. So this macula, usually one of the most common disease associated with this macula is, you probably know it, age-related macular degeneration. So this is AMD, age-related macular degeneration disease. So this is a short form. It's quite common in particular ethnic group, Caucasians. I think is if you search the literature, the study showing that this AMD, age-related macular degeneration, occurring more common in the Caucasian population. And of course, also can occur in the other ethnic groups, but this is just the most occurred groups. And this is really degenerative change. It's just with time, with age, the pathological change of this acute macular degeneration is the deposit of some waste. Right? Probably if in non-medical term, just some trash, or the waste, lipid, or any other chemicals deposit there. so impair the vision, so cannot see sharp vision. Instead, you're seeing the distorted vision or distorted images. So that's the early sign. And the worst scenario or the worst complications or the prognosis of this macular degeneration is that because of this waste deposit under the macula, and the eyes receive the message that I cannot see well, I'm going the ischemic damage, I need more blood vessels. So the newly neovascularization, the newly growth blood vessels under this retina, they're not the normal blood vessel, cannot have the normal function to provide oxygen. On the other hand, increase the risk of hemorrhage, bleeding. So then really eventually will cause the blind. That's probably one of the most common cause of blind by this AMD. That's the latest stage. So this is kind of a little detail, just give you some idea. If the AMD, age-related macular degeneration, was not treated, was not managed by the physician, eventually will become like what I mentioned, neovascularization, hemorrhage, and the loss of vision. So that's one of the very serious complications. And the other, so this age-related macular degeneration, as name implied, occurring in older people, even though there's a trend that the age start to become earlier, but still it's age-related, which means occurring in the older people. The macular diseases can also occur in the young, healthy people. It's just like somehow without a cause, probably you can call it idiopathic, because you couldn't find the reason why. It's called the macular edema. Just the fluid accumulate under this macula. So the signs, the vision start to be obscured, seeing halo or seeing not clearly, and with or without pain. So this is usually, this occurred to young or older, or with or without systemic disease, with or without a cause. This macular edema can also occur in those pre-existing retinal diseases like diabetic retinopathy or hypertension caused retinopathy. Of course, that's one of the most common causes of this macular edema. However, I mentioned in the young people, in the people of healthy, either young or old, can also have this macular edema. And sometimes the treatment is, depends on the amount of the edema, the fluid, can be treated with the laser to, it's just like the staples to staple your retina. So stop the more fluid accumulation, or in some cases just a watch. Especially for if you have been healthy without any conditions, without causes, then can watch, periodically follow up, make sure the fluid will be absorbed. So this is but however, if it's not treated in time fashion, if it's not eradical treat of the fluid, then eventually the consequence could be serious. So anyway, so this is just a fundamental knowledge about the eyes, the macular, and particularly for those older people had risk factors for the AMD. The risk factors, of course, aging and also the oxidant damage. And so the prevention I mentioned earlier, and the previous video I also mentioned antioxidant, vitamin E, vitamin C, and any other well-studied vitamins can help. So I'm going to stop here, and hope it helps, and hope at least the trigger your interest to search more, to find more information, to maintain your health for the eyes and the sight. So I'm going to stop here, and hope it helps, and thank you for watching. I will see you next time.